cancer can be prevented. We shouldn't wait till it occurs.
If you catch it early, there's a 90–95% survival rate, which are good odds. If you take those odds to Vegas, you'll break Vegas.
We know that our enemy is cancer, and we're going to conquer it.
There are more than 200 types of cancer, and because cancer does not discriminate, people of all ages, races, and ethnicities can get it. Some people may recognize that something is wrong with their bodies and go to the doctor. But people with inadequate access to health care, especially people of color and anyone living in rural areas, may not get the treatment they need.
When you go get checked for a doctor, it's like, I'm afraid, I don't want to go get checked. If I go get checked, they're gonna find X, Y, and Z that's wrong with me, and I don't want that. So I mean, that could be an aspect of it.
There is minimal support out on the reservation, and a village maybe an hour and a half away from the hospital.
I think it's up to the tribe to get educated because, like I said, I heard about cancer, but under the health department, I don't think they ever did an education on cancer.
The result is a disparity in cancer deaths among Arizona's African Americans, Native Americans, Asians, and Hispanics. These groups have higher rates of people dying from cancer than other populations. But the University of Arizona Cancer Center is working hard to lower these numbers through its Cancer Health Disparities Institute.
One death from cervical cancer is one death too many. Mexican American and American Indian women are more likely to die of cervical cancer than their white non-Hispanic counterparts. We have all the tools at our disposal today to be able to prevent every single cervical cancer death. We have a prophylactic vaccine that is very effective. We have screening techniques that are also very effective. The issue is getting access to those services from populations that may not have access to them.
At the Cancer Health Disparities Institute, doctors and scientists focus on understanding, preventing, and treating cervical cancer, breast cancer, gastric cancer, and colorectal cancer. These 4 cancers affect all populations, but they have especially poor outcomes for people of color.
Disparities is about underserved communities. It's about poverty. It's about lack of access. Any individual who doesn't have the means to get the care, to get the preventative access, who doesn't have the means to afford that care, is at a disadvantage no matter what his or her color is.
When my relative died, they called it the sickness that never healed. And so I thought I was going to die when I had it, and I made myself worse.
But Della Williams of the Tohono O'odham Nation survived breast cancer because it was discovered in the early stages, thanks to a free mammography screening.
All that time I didn't know what it was all about because I never heard of cancer.
The University of Arizona reaches out to Della and others throughout the state, educating them through health fairs, colorectal screenings, and other efforts. At the same time, researchers and scientists are working full-time to find answers to the many questions about cancer.
Here at the Arizona Cancer Center, we have labs that are focusing on finding drug discovery. So again, finding drugs to treat cancers. There's labs that are working to characterize cancer. How is this cancer behaving in population, in the Hispanic population, in the Caucasian population, in other populations?
Jose Munoz Rodriguez is a graduate student training in a laboratory that researches breast cancer. This type of cancer is found in Hispanic women at younger ages than in non-Hispanics.
There's hope. There's hope. There's still quite a ways to go, but there's that hope, and there's advances regularly. I'm in a position to make a difference on breast cancer research, but specifically in the Hispanic population.
Gastric and colorectal cancers are also a priority. These cancers affect people of color and those living in rural areas, who often don't get the screenings needed for diagnosis. Art Chapa of Tucson didn't recognize the symptoms of stomach cancer, also called gastric cancer, until it was too late. Just 14 days after his diagnosis, he died.
The type of cancer that my husband died from the H. pylori-induced gastric cancer is very prevalent in the Hispanic community and in the Indian community. His death was a shock to everyone.
The Cancer Health Disparities Institute is trying to help people in all parts of Arizona learn about cancer so it can be prevented. But community support is needed to reach everyone. One source of support for men, especially men of color, is the Southwest Prostate Cancer Foundation.
What our main goal is to make sure that the disparity problem is eliminated. 700,000 men in Arizona have no insurance. This is where we try and reach out to those communities and make sure that they start understanding, to educate them about things that they need to do in order to improve their health standards. You help yourself by getting annual checkups.
Learning about cancer might make you feel uncomfortable, but it can save your life. Eliminating cancer disparities can save many lives. What can you do to help? Contact the Cancer Health Disparities Institute if you'd like to participate in clinical treatment and prevention studies, learn more about cancer prevention, or donate time and resources to the Institute's effort.
40% of people in their lifetime are going to have an invasive cancer. This is the biggest health problem by a long shot in the United States. It's very exciting to be a part of a research team and to have an opportunity to do something that could change people's lives.
Cancer is not a death sentence. Cancer can be prevented. Cancer can be treated. You can survive cancer.